Welcome to Pinoy Medical Coder. Today, we'll discuss about ICD-10 official guideline for coding and reporting by step-by-step medical coding. Before we begin, please don't forget to like our Facebook page and like and subscribe to our YouTube channel. These coding guidelines for outpatient diagnosis have been approved for use by hospitals, providers in coding and reporting hospital-based outpatient services and provider-based office visits. Guidelines in Section 1, Conventions, General Coding Guidelines and Chapter-Specific Guidelines, should also be applied for outpatient services and office visits. Information about the use of certain abbreviations, punctuation, symbols and other conventions used in the ICD-10 CM tabular list, code numbers and titles, can be found in Section 1A of these guidelines, under conventions used in the tabular list. Section 1B contains general guidelines that apply to the entire classification. Section 1C contains chapter-specific guidelines that correspond to the chapters as they are arranged in the classification. Information about the correct sequence to use finding a code is also described in Section 1. The term encounter and visit are often used interchangeably in describing outpatient service contacts and, therefore, appear together in these guidelines without distinguishing one from the other. Though the conventions and general guidelines apply to all settings, coding guidelines for outpatient and provider reporting of diagnosis will vary in a number of instances from those for inpatient diagnosis, recognizing that the Uniform Hospital Discharge Dataset, UHDDS, definition of principal diagnosis does not apply to hospital-based outpatient service and provider-based office visits. Coding guidelines for inconclusive diagnosis, probable, suspected, rule out, etc., were developed for inpatient and do not apply to outpatient. A selection of first listed condition. In the outpatient setting, the term listed diagnosis is used lieu of principal diagnosis. In determining the first listed diagnosis, the coding conventions of ICD-10 CM, as well as the general and disease-specific guidelines, take precedence over the outpatient guidelines. Diagnoses often are not established at the time of the initial encounter, visit. It may take 2 or more visits before the diagnosis is confirmed. The most critical rule involves beginning the search for the correct code assignment through the alphabetic index. Never begin searching initially in the tabular list, as this will lead to coding errors. Examples. Select the first listed diagnosis. Established 50-year-old patient was seen in the clinic for acute bronchitis. Patient also received a prescription for a refill of medication for hypertension. The first listed diagnosis is acute bronchitis. Initial office visit for 36-year-old female complaining of irregular menses. Review of system identified unexplained weight loss. The first listed diagnosis is irregular menses. Established patient is a 75-year-old male complaining of substernal chest pain, which is relieved with rest. Patient has hypertension and blood pressure is above baseline on this visit. The first listed diagnosis is substernal chest pain. Most physician will document the chief complaint of the patient for each encounter in the medical record. The chief complaint, CC, is the reason the patient presents for the medical visit. The CC is one of the keys to determining the first listed diagnosis. The chief complaint is the reason for the visit from the patient's perspective. For example, a patient consumed a soup that contained shellfish. The patient is allergic to shellfish, and develops hives. The chief complaint and the first listed diagnosis is allergic hives, due to allergy to shellfish. L50.0, allergic urticaria. Z97.013, allergy to seafood. Other times, the patient's complaint is a symptom of a more complex diagnosis. For example, a patient presents with a chief complaint of backache, and after examination, The physician determines the patient has an acute kidney infection due to Escherichia coli. The backache was a symptoms of the acute kidney infection. N10, acute pyelonephritis. B96.2, Escherichia coli, E. coli, as the cause of disease. Classified elsewhere. The patient may also schedule a visit without a chief complaint. As examples, the patient requests a physical to qualify for insurance or may be an expectant parent seeking to establish a pediatrician. The reason for these visits can be reported as first listed codes using codes from Chapter 21. Z02.6, Encounter for examination for insurance purposes. Z76.81, Expectant parents pre-birth pediatrician visit. This video was brought to you by Pinoy Medical Coder. Thank you for watching.